Panelists ready to go? Should we get started? Yeah? Okay. Let me kick it off. Well, welcome everyone. Thanks so much for making the time to join us today. I'm going to say good morning. I'm joining today from Banff, Alberta. I'm traveling a bit for some volunteer work. So I'm joining today from Treaty 7 territory on the Bow River. So welcome and thanks for letting us know where you're joining from today. Thanks for joining. Our title today is Shared Purpose and Progress, Building a Unified Pan-Canadian Community-Based Senior Services Sector. Such important work. And on behalf of the Interim Community Leadership Council for this work, we're so excited to have you here from Marta and myself and the HelpAge team. Thank you so much for being here. Just a couple of quick housekeeping items. If you could use the chat for your introductions, and then we're going to use the Q&A function for questions. We're going to have lots of time for questions at the end of today's session. Today's session will also be recorded, so hopefully everybody's comfortable with that. Just keep that in mind. HelpAge Canada acknowledges the homelands of Indigenous peoples of Canada and honors the territorial keepers of the land on which we work. We recognize that our work occurs on traditional Indigenous territories right across Canada. And so thank you all for including in the chat where you're also joining from. Appreciate that. So thank you to the HelpAge team. They're going to help us out with moving our slides forward. So on today's agenda, we have reflections of the great work that's happened over the past year. There's been so much that's happened since our last summit in June of 2024. We're going to have a panel discussion to share some reflections on the work that's happened and also on the work ahead. Kahir is going to, with the HelpAge team, is going to share some exciting news about the work ahead coming up in the coming year. And then we'll have some time for some Q&A with all the folks who have joined us here today. So our speakers today, we're so pleased to have such a great panel. Thank you to everyone who's joined us. We have Marta Hajek, our co-chair for Pan-Canadian Community-Based Senior Services Leadership Council and CEO of Elder Abuse Prevention Ontario. Gabrielle Gallant, the Policy Director for the National Institute on Aging, NIA. Bev Buckway is a Community-Based Senior Services representative from the Yukon Territory. And Kahir Lalji is the Chief Executive Officer for HelpAge Canada. So welcome, everyone. Thanks for being here. I'm going to turn it over now. Bev.
Good morning, everyone. What a wonderful turnout from all across Canada. It's great. The last year has been very busy for the team. There's been lots of interactions at the 2024 Summit. There's been personal visits to some of the provinces and territories. And of course, the emails and the correspondence have been going back and forth wonderfully. It's great. And last year's summit in Ottawa was one of the most well-organized, informative, and friendly conferences that I have ever attended. The turnout was wonderful, and the attendees generally agreed that national coordination would be a great help to all the organizations that work with our older population. And I would urge you to mark your calendars now for the summer of 2026 for a repeat performance that we're going to have. When you have over 320 people coming together for the first time, the outcome can always be a bit of an unknown. But in this case, there was a clear mandate quickly noted. Given that the delegates were from all over Canada, it was really heartwarming to see the agreement on the key findings that can lead to better advocacy and national coordination. Not all the items, of course, were top of mind for each location, with some being more urgent than others, but strong themes nevertheless emerged. The struggles and challenges are similar, pointing to the need for involvement of the older population in the decision-making. We had discussions about ageism, what it means and how it makes us feel. We learned about the social isolation, which affects a large number of the older population, and how collaboration is really integral to finding the solutions. And today is just one step further ensuring that collaboration. Particularly important is further work on collecting data from across Canada that will help provide stronger and more knowledgeable and a united voice. Many organizations operate on shoestring budgets. They lack stable and adequate funding, and that also hinders the consistent staffing and expanded programming. The good news, though, is that some of our provinces have very successful CBSS models that we can learn from. So keep your ears open today to learn more about those possibilities. Back to you, Karen.
Thanks so much, Bev. So over the last year, from June of 2024 to this moment in time, we focused on building a strong foundation for a unified community-based senior services sector. And this past year has been one of critical progress. So following the inaugural summit in June of 2024, the Interim Community Leadership Council began by developing a framework for regional consultations across Canada to gather insights directly from older adults, service providers, community leaders, and allies. These sessions in British Columbia, Manitoba, the Yukon, Saskatchewan, and Nova Scotia created space for reflection, for dialogue, and for identifying shared values and priorities. This input will be instrumental in shaping our vision. Collectively, this work is by community for community, and for informing the work and consultations ahead. In parallel, we began work on key elements to support the work of the Interim Community Leadership Council and the CBSS sector development work. Things such as a communications and governance subcommittees, the partnership with the National Institute on Aging to support data and policy needs for the sector, the exciting move of Core Canada to Help Age. We also initiated early design conversations around how we support consistent measurement within the sector. So things like visioning, shared definitions, evaluation tools, and standards that might enable alignment with data collection and reporting. As we look at the findings from the 2025 regional consultations that have been held to date, and we think about reflecting on the 2024 CBSS Summit, we see both alignment and the evolution of the sector's thinking. There's strong similarities. Both the summit and the consultations identify persistent issues of fragmentation across the sector, unstable funding, and human resource pressures, including staff burnout and volunteer shortages. They also express a shared desire for greater national coordination and more collaborative action and a sector-wide effort to combat ageism and reduce social isolation. In both cases, data and evaluation and capacity building and advocacy were seen as essential tools for moving forward. Where the 2025 consultation findings differ a bit is in the depth and specificity of what was shared. These priorities represent, perhaps you could think of it as like a next phase of thinking, a shift from broad issues to more concrete insights. For example, stakeholders across regions spoke to the need for centralized service directories, shared definitions and evaluation frameworks, and the creation of perhaps a national convening body to lead collective efforts. These were identified priorities, proposed directions for collective work that lies ahead. They do perhaps offer a roadmap shaped directly by the voices from across our country that give us an opportunity to guide how we begin to tackle these longstanding challenges within the sector and continue to undertake our engagement across provinces and territories and look towards our next national summit. Did I jump ahead, Felicity? Sorry, I apologize. We have one more slide with some information about our regional gatherings as well. Oh, there we go. So panel discussion. We wanted to provide an opportunity for some reflections from our panel. And so I have a few questions for the group to stimulate discussion before we head into some additional highlights from our Help Age team. So Marta, maybe I could start with you. From your perspective, what strengths exist in the CBSS sector that we can build on?
Thank you for the question, Karen, and welcome to everyone who's joined us today. From our perspective, and I think as we're doing these consultations across Canada, within the various provinces and territories, there is a unique lens within each of those geographic catchment areas. But there are a lot of common strengths that we share. I think the important piece is for us to look at collaboration in the true sense of the word, not to be competitive, but to be able to put best practices forward that we can share and continue to build on. I know that word collaborative or unprecedented have been worked to death over the last couple of weeks and months, but I think it's important for us to really know who our potential partners are in the sectors, those that have already demonstrated best practices um, that can guide areas of specificity. So, for example, for our own organizational expertise, it really lies in elder abuse prevention. So we can put that on the table, and we know who our partners are across Canada, provinces, and territories, and we're able to draw and leverage each other's strengths and fill in the gaps where we know that they exist. Those best practices will be, I think, very important to inform the work that we do, at least from our sector.
That's great. Thanks for those insights, Marta. And maybe building on that, Marta, Kahir, what are some of the biggest barriers, some of the challenges, systemic or otherwise, that we think we need to overcome to drive or catalyze impact within the sector?
I hear
Oh,
you muted.
I'm happy to go first, but I just wanted to see if our colleague at NIA had any thoughts on some of the strengths as well.
Thanks, Kahir. I did want to comment on some of the strengths of the CBSS sector. From my perspective, with a kind of a pure policy lens, I think the biggest strength of the CBSS sector is the upstream impact that it has on the well-being of older adults in Canada. We talk a lot about how the CBSS sector is filling gaps that are left by the rest, like the rest of like the government, the healthcare, community care, home care. It's the CBSS sector that's coming in to fill those gaps. So I really think that the strength of the sector is in the outcomes. We know that LTC admissions can be avoided if there's good home and community care. We know that community care fights loneliness and isolation, and that loneliness is the equivalent to smoking when it comes to the impact on an older person's health, or I guess any of our healths. So I think that the big strength of the CBSS sector lies in how deeply rooted it is in the community and how effective it is in creating those positive health outcomes for older adults. And sorry, I jumped in without saying, I would have liked to say first, thank you very much for having me. I'm happy to be here. I'm particularly happy to be here with Bev Buckway, because I got to visit Bev in the Yukon, and Bev was the most wonderful host to Kahir and myself as we met some CBSS organizations in the Yukon.
Yeah, so I thank you for saying that, Gabby, because while we've seen so much strength and success from the sector, I think a lot of us can understand that our sector also faces some barriers, many of which are systemic in nature. And I'll offer maybe four thoughts, and then maybe hand it over to Marta to add. One is there seems to be inherent challenges around access and equity, particularly within all partner systems, but also within the CBSS sector itself. I think about the diversity of people, the diversity of spaces, and the diversity of places that exist within the sector. So, for example, one of the most beautiful parts of our country is our geographical landscape, but they can also pose access challenges for many communities and many organizations, and those are real issues that we need to figure out. We also know that older people are not a homogenous population, and if we really want to be relevant and meaningful to the programs and services for the people that we are serving, we need to figure out in a fiscally constrained but prudent landscape how to adjust and really be person centered, so that we're providing programs and services that are truly meaningful. And sometimes we can get lost in a one bandage approach to all that we're serving, and so really being intentional on access and equity in the work that we do. Um, One of the things that we found so far in the consultations to date is that we really need to be advocating for and intentional in supporting older people in rural and remote parts of the country. that face disproportional barriers and challenges in resource allocation as well as service and program delivery. And so really being focused on equity and access. The second piece I would say is around system recognition, which is kind of attached to our country's philosophy of care. Rightfully so. There's a lot of focus on primary care and healthcare services. But I think many of us on the call will understand that the impact that our collective sector does fundamentally affects the trajectory of life for the people that we serve. And sometimes our sector isn't recognized that way. It's not resourced that way. It's not understood as part of the overall healthcare service continuum of service delivery. And so really being able to shift our philosophy of care, whether that's through amplifying our collective stories, whether that's through policy reform, whether that's engaging with our systems partners in a different way. We need a seat at the proverbial table, if you will, to co-create with government, with funders, and with others the pathway for the community-based senior services sector. I think I'll just add before I hand it off to Marta here that we have a uh, we have a bit of a scarcity mindset in the way that we operate, and that's a result of being under recognized, under resourced over the last many years of service. I think what's exciting though that there is a recognition or an increased recognition of the work and impact of community-based organizations and services. And I think we're at a time where if we can galvanize appropriately, we can push our sector forward. Marta, I don't know if there's anything you wanted to add.
Thank you, Kahir. That's pretty comprehensive. I just wanted to add the resourcing piece is, that's the reality that we're all operating in. So if we are short of funding, therefore we are short of human resources to be able to tackle the various issues that each of us, specialize in or the services that we offer. For that reason alone, we become competitive. We start to really isolate and work in silos because we're all competing for X number of dollars. If we can put some formality around the structures that we recognize the work that everyone is doing in community and really leverage, who's doing what best, build on that, and then put that forward to the decision makers at all levels of government where they can inject themselves as a valuable resource to the sector. We're doing our share of the heavy lifting, but it's not recognized in such a way that we don't have to fight for every dollar and fight for every minute of the day to continue to deliver on our mandates and not worry about funding.
Thanks for saying that, Marta. Sorry, Karen, I'm just quickly interjecting here because one of the things that's occurred to me, Marta, when you spoke and in conversations with organizations across the country is, over the years, the word administrative cost has become a bit of a taboo word when talking to funders, and I think we need to galvanize. I often tell people when you go buy a cup of coffee, you're not just paying for the coffee beans and the cup. You're actually paying to keep the lights on at the coffee shop. So why should that be any different for our sector that requires cost recovery to keep our lights on, to pay staff appropriate wages, to be able to modernize our operation so that it can enhance the work that we do. And so I think, Marta, that triggered a thought to me when you're talking about resource allocation. It's the value of investing in the sector.
Absolutely.
I'm not actually supposed to get to answer this question, but I want to add one little, this is makes it fun. It's live, it's dynamic. I want to, I feel like we could sum up what Kahir and Marta just said as an acknowledgement of the value and the impact of the CBSS sector. That is one of the biggest barriers to the development, to the the government funding to the integration with healthcare and housing systems is an acknowledgement of the impact. So when I look at this work from an advocacy perspective, one of the first things I'm thinking in terms of like steps incrementally, how do we get done everything that we want to get done? The first step is an acknowledgement. There needs to be an understanding from governments across the country at all levels of the impact that the CBSS sector makes on the lives of older adults and how that impacts the other healthcare systems that they're paying for.
Absolutely. I feel like you guys have already jumped into the next question.
Sorry.
No, that's great. It's great. It's very fluid. Um, but I really appreciate that point. And I think I'm gonna turn this next question over to Bev because it rolls into some of the comments you guys have made, is really why we're all here today. We've got almost 200 people on the call, all for the same reason, is how do we create a strong, unified, community-based senior services sector? What are your thoughts on that, Bev?
Well, and I come to this, Karen, as the newbie to the group. So my comments are not based on someone that's been around this for as many years as the rest of you have. But I would say that, first of all, the organizations in our territories and provinces that deal with the older population have to know what a CBSS is and how it works. And I recently caught some of the G7 on CPAC. I tuned in just as the Canadian Chamber of Commerce was doing their portion. And I thought, there's an example that most people would understand across the country is you have your local Chamber of Commerce, you have your provincial or territorial, and then you go up national. I thought, okay, that makes sense because a unified CBSS would also be that strong cross-border voice to government. And while recognizing the differences within province or territory or between them, but having that and then having the relevant data and evaluation is also really key here. I would also say that you get a real increase in knowledge, and that can lead to the best practices. And Marta mentioned that as well. And I think back to the Rotary student exchange that I'm familiar with in my past life. And, the organizations could have a situation set up where some would go spend some time in another location and they could see how things are done differently. And the observations might be better and it works at home, or it might be worse at home. But the hands-on experience and seeing leads to the improvement on both sides. It could be a board member that might go, it could be an employee that might go, but it depends what the outcome is as well. I was totally amazed when I went and visited the seniors centers in Lethbridge at what they had. They had a workshop area and a craft area, and they had a fine lunch that they served every day. So you see that and you say, wow, potential is huge, but you have to know what's out there. You have to know what you're looking for.
Yeah, Bev, I
Thanks.
really appreciate that point. Like, I think that's why I'm getting so excited about these regional gatherings in the different territories and provinces, and then coming together nationally is how we share best practices. And then also looking to other sectors that have done sector development. I've been so inspired by the work around the early learning and childcare sector, around workforce development and public policy work with government, and how can we look towards those other systems. So I did not watch the G7 in detail, but that's a great example, right? Is how do you present the sector and the work that we do um, in a meaningful way around public policy development. That's a great example. I'm going to ask our folks on the call to please continue to put your questions in the Q&A function so that when we get to that point in our session today, we've got lots of opportunities to bring those forward. And then I'll turn it back to the panel. Again, just the question was, what do you think a strong, unified, community-based senior services sector would look like? Does anyone want to pick that one up?
I would be happy to. I think that there's a few things. One, a national voice, which is something that we're working very hard at pulling together here. I think shared objectives and shared metrics and measurements is another really important one. And again, that's part of what we're working on here. Clear, sustained, stable funding, predictable funding. As Kahir mentioned, governments are always pointlessly neglected or what am I trying to say? They don't want to do program funding or operational funding. They just want to do programmatic funding. So we need sustained operational funding. And I think if we could pull together those sort of puzzle pieces, like sustained stable funding, a national voice, clear standards and metrics that we're going to measure from. And then the last puzzle piece, I think, is like there needs to be, and I feel like we're so far away from figuring out how to operationalize this, but there needs to be a seamless integration between the work that all the organizations on this call are doing with the housing and the healthcare systems so that it's one unified CBSS sector across the country.
Those are some of the very important points. Thanks so much, Gabrielle. Kahir or Marta?
I was just going to say there is value in bringing together, various players across Canada because, for example, in elder abuse prevention, we sort of work through the Canadian Network for Prevention of Elder Abuse, but each of the provinces are resourced very differently. So when we have our board meetings and we have our community discussions, it's essentially a community of practice where we come together and we are able to share what those best practices are and then help other provinces that are perhaps less well resourced to not reinvent the wheel, but to start. So a couple of years ago, Canadian Network for Prevention of Elder Abuse came up with the roadmap for how we would develop the networks across Canada. And it has been extremely effective. It's a great information piece, and I would encourage everybody, this is a shameless plug for CNPA, but I would encourage people to look at that because regardless of the issue, the methodology can be overlaid for other issues as well. So whether it's housing, transportation, whatever those issues are, but it is a very good roadmap.
I'll just say copy and paste, copy and paste, copy and paste everybody's responses. But for what it's worth, I'll offer a few cents worth here. One is, the CBSS sector across the country comprises just over 10% of all nonprofits and registered charities in Canada. That's not immaterial, right? That's close to about between 8 and 9,000 registered nonprofits and charities that's in some way provide community-based programs and services for older Canadians. I also think that's pretty powerful. And I think, that there's exceptional work happening through all of the staff and volunteer and organizations and in communities. And just imagine if we can enhance that impact a little bit more strategically in a way that's a little bit more connected. We often are so heads down in operations. We know that even just connecting with one another is hard. And I think the value of a unified sector allows for better connection amongst organizations, amongst staff, and amongst programs and programming. I also think a robust, unified sector, and I think we've seen this in some provinces already, and I think it's emerging in other provinces and territories, is the ability to be nimble and the ability to pivot, because the reality is our sector is influenced by external factors to our sector, things like those that might be the sitting government of the time, things like the economic or cultural or political landscapes that surround our CBSS sector. And while they surround us, they are inextricably linked to what we do. And when we are connected and when we are unified and when we have those shared objectives and shared values and shared metrics of success, we're able to better pivot and nimble. And I think, the world is going through some tricky times right now, but I think just behooves the sector more to be able to respond in a more coordinated and connected way. The final thing I will say is the value of cross learning. And there are some parts of the country and some organizations that do certain things well, and there are others that do other things well. And we can leverage each other, and we can learn from each other. We can scale, and we can enhance each other's work in a way that may not be possible if we continue to operate, in smaller silos. So just some additional thoughts there, Karen.
That's excellent. Kahir, I appreciate that. And I think that's a great transition to the next question I'm going to ask Bev. It's really an important question, I think, is Bev, how can the sector better serve older adults who maybe more are most at risk of being excluded? So those that are in rural, remote areas, Indigenous seniors and elders, and those that might be facing economic insecurity.
Great. Well, thank you. And Tahir and Gabby are certainly our cheerleaders, aren't they? Based on what I see in the Yukon, not all communities have an organization that is specifically representing the older population. Here we have over 600 NGOs with a population of 47,000 people. And that means a lot of little organizations are vying for the same board members and the same volunteers. And quite often it's those volunteers that are working without a dedicated space and a limited budget. So the scope is limited and the opportunities are really lost. And as I hear mentioned about, you have to scale it to the size. Sometimes, again, with what I'm familiar here, our services and opportunities are coordinated by an order of government. It could be municipal, it could be First Nations. So the city of Whitehorse is one example. They offer recreational opportunity 2 mornings a week on a drop-in basis. You can go down, play shuffleboard, pickleball, bocce, but you also maintain those really, really important social connections. So then that leads me to a question, should the municipalities be considered as CBSS members? And speaking of a recent lost opportunity, many of you will know this, but the Yukon sends many participants to the 55 plus senior games. And last year we had a 91-year young woman who won 2 silver medals in swimming. How's that for not being socially isolated, right? And the games are postponed for 2026, and that leaves a huge hole in bringing together the older Canadian population to a really extraordinary event. And so you think again, so should some of the organizations that work with those folks, could they be part of the CBSS organization on a national basis? We talk about how we're doing today. We're meeting over Zoom. So in a lot of our little communities, the internet is unavailable or it's unreliable. So the digital connections can really be challenging. And I find that many older people in the rural areas, they just don't rely on the digital services, due in part to the cost of owning the great little machine that we're all working on today. You got to pay for the connections. You got to pay for all the subscriptions. You have to keep all the malware and everything out. And then in little small places, who's going to come fix your computer? There's maybe nobody in the community that helps you keep things running. And if you didn't use a computer in your work life, it's maybe pretty hard to start picking it up when you retire. We all know the difficulties of trying to communicate with Canada Revenue, for example. And then you pile in all the scams, and for some people, it's really tough. I know that small communities can gather people together and sign on to do a joint digital meeting, but it's not the same as being able to sit as we're doing today and see everybody clearly and hear everybody. So I think sometimes the use is really limited. One of our organizations did considerable outreach to invite rural people to attend the presentations by Zoom. And the only uptake was from the community of Haines Junction, where the seniors gathered together to join in. So thank you, Haines Junction, for doing that. But over and over, we heard that having gatherings or things in person is much more preferred than trying to do digital. If you think of a fly-in community, or if you have to drive 450 kilometers to get to a conference, you got your airfare, you got the gas, you got the premiums, you got accommodations. It can take you 4 days to attend a 2-day conference, and the price tag's over $2,000. So that's a huge chunk out of an organization or a personal budget to attend and be connected. You add in language and cultural differences that are very evident in our diverse population. And, as we agree, ditto, it's really hard to bring people together. But we want everybody to feel included and to be part of it. So the challenges become one of finances and logistics. If you start small, you can see the possibilities through some really coordinated efforts. There's lots of room to grow. I think too that the first time that somebody is exposed to a larger organizational network can be a very intimidating experience. But when the light bulb goes off, the ideas percolate, the friendships are formed, and the next round of work starts. Why didn't we think of that, you might ask? And in my experience, nobody Absolutely nobody will refuse to spend time with you and offer advice if you reach out and ask questions. That's a totally positive undertaking. And that's where the willingness to see the benefits to the CBSS sector lies. If it comes down to having strong representation, someone who will rise to the challenge, do the networking, share the information back and forth, takes time and dedication. But based on what I've seen, we are ready to move forward in Canada. Thanks.
Yeah, that gave me goosebumps, Bev. Thank you for that. I think you just really captured the unique role that the community sector plays. It's all relational. It has to be about having the opportunity to build those relationships. And I think community is so uniquely positioned to try and respond to the needs of folks who might otherwise not make those connections for a variety of reasons because of the things that you just highlighted. It's not an easy thing to do, right? Though it does require a lot of intentionality and resources, but I think community as a system and as a sector is uniquely positioned to do that. And I think you just captured that so eloquently. Thank you. Ah, that was great. Kahir, I was wondering if you might tell us a bit about the value of, I think building on what Bev just captured so beautifully, the value of networks and partnerships and collaboration in terms of the efforts around sector development and sector building.
Yeah, thanks, Karen. So, first of all, I just want to recognize, right, the outset, like, collaboration is can be messy. It's not always easy. And but I think we think it's so valuable to kind of push our work forward, whether it's talking to government, whether it's scaling our work across different territories and provinces and communities. I think connection and collaboration is so important. As hard as it is, it's hard on time, and it can get a little bit gray, which is a reality of partnerships and collaboration. The second thing I would say is there is a continuum of collaboration, right? And I think, we need every province and territory will be at a different place on that continuum of collaboration. And I think it's really important to recognize that there might be different approaches across different territories and provinces, and across even regions within provinces and territories, even within municipalities and local regional districts. And that's part of the nature of this work, is that how a network or how a collaborative forms could and feel and look different. And that just speaks to the diversity of the work that we do in this sector. I think one of the most powerful things is the ability for networks and collaborations to have intentional reach. And it kind of goes to what Bev was just talking about. How do we reach some of the most isolated? How do we reach some of the most vulnerable people in our communities that might have compounding barriers to access? Um, uh, you know, I think this is the role that our collaborations and networks can play at a hyper local, hyper community level. Look, the 200 or so of you represented on this call know your community is the best. And it is that information and that learning that can help inform a sub-regional, regional, territorial, provincial, and ultimately a pan-Canadian approach. I think robust networks and robust collaborations really allow for authentic learning. It allows us to scale things that are working. It allows us to be able to connect with one another to learn at a micro or macro level. And it also, I think, ultimately can make our work a little bit easier in terms of our scope. Like, how many of us are trying to do fit squares into circles for a few $1,000? Like, I think there's ways for us to be able to do our job a little bit easier. Um, the I'll also say, networks and collaboration really need to be reflective of the cultural, the demographic, and the environmental landscapes in which we're operating. So, for example, you know, some places in the country may be at a different place in understanding what the community-based senior services sectors actually is, and that's okay. And I think this learning mindset and this growth mindset is what can help us amplify our impact through networks and through collaborations. I think, in an ecosystem as large as ours, there is risk of not collaborating. And I think we've seen some of the products of that risk over the last 8 to 10 years. But we've also seen the potential of what can happen when we have collaboration and networks that are formed. But I think central to that is this concept of trust and of relationship building. Another piece of work that takes time. And, it's not lost on us that collaboration and network building takes time. It takes authenticity, it takes trust, and it takes what I might call organizational vulnerability to be able to say, this is what we are good at, and this is where we need to seek partnerships with. But I think that's another way that we can through collaboration make our work easier, is leveraging what we're good at and leveraging others in areas that others might be good at.
Thanks, Kahir. We're going to have one more question for the panel, and then we're going to do some updates on the work ahead. Gabrielle, I was wondering if you could talk a bit about the NIA survey. Share some important finding. The NIA survey shared some important findings about how older adults in Canada are experiencing aging. Was there anything that surprised you or felt especially important to spotlight for this audience?
Thank you so much. For the folks that don't know, the NIA is in year 3. We're doing data collection right now for year 4 of a large experiential survey. It's 6,000 older adults. It's going to be more representative in this next upcoming year. And yeah, there's a lot of things that are pretty fascinating about it, but a few things that, or maybe a few lessons that I wanted to highlight that I don't think will be very surprising to the folks on this call. But one, healthcare access isn't universal in Canada. We believe that universal access to healthcare is a Canadian value, but you guys probably know intuitively, and now we have data to demonstrate that healthcare access is uneven and it's actually getting worse for the people that need it the most. We're going to have a report coming out soon on rural access to care, pulling out data from our survey, and it points out or highlights the fact that that older adults in rural and remote parts of Canada are often most likely to need to access care, but are often least likely to be able to get care. 1/3, or 3 out of 10, so not quite 1/3, but about 33% of older adults are unable to access healthcare that they need when they need it. And inconsistent access to care, it erodes health, it erodes independence, and it certainly has a negative impact on social isolation and loneliness. So one, I will say that universal access to healthcare in Canada is not universal. One lesson coming out of our survey. Two, poverty plays a bigger role in the lives of older adults in Canada than official statistics think they do. Poverty is aging silent partner in Canada. Official poverty metrics would say that there are 6% of older adults in Canada that live in poverty, but the NIA survey applied a different poverty metric called the Material Deprivation Index. And the MDI looked at poverty among older adults from a what they can't afford or what they have to go without perspective. And that found poverty rates at almost double than official metrics. And why is this important? It's important because the experience of aging is shaped by financial security, and whether someone survives or thrives or falls through the cracks can often depend on what's in their bank account. Our survey finds, and I'm sure everybody knows this intuitively as well, that low income limits access to care, it limits access or to community life, and even to some basic necessities. And when it comes to aging in place, which is what most older adults in Canada want to do, poverty has a huge impact on that as well. So 2 lessons so far. 1, healthcare access isn't universal. 2, poverty is the silent partner to aging in Canada. And 3, to be a little bit more positive, I'll say that we ask a question about what people's perspectives, their overall POV on aging is. And through that question, we find that the attitudes that older adults have towards aging are actually better than the systems that support them. 62% of older adults feel positive about aging in Canada or growing older in Canada. And I think that really demonstrates that there's an opportunity. There's a mismatch right now between what older adults value and what the systems are delivering, but this is a solvable problem. And if you can measure it, you can change it. So hopefully the survey data that we collect here and in future years can continue to inform policy development from governments across the country. That's something that we're certainly going to continue to advocate for. But we also really hope that the survey data can be useful to the organizations on this call. We were just in Atlantic Canada with Kahir and Felicity and Karen, and we had the opportunity to slice our survey data from a regional perspective for the first time. So we were able to share a regional, just Atlantic Canada, what those survey numbers look like just for Atlantic Canada. I'll share that link in the chat in a moment. And we're going to work on slicing our survey data like that for all the regions across the country so that all the folks on this call, we hope that you can use this survey data for your own purposes to help you, tailor the services that you're providing, to support funding applications, to help better understand the populations and the clients, the demographics that you're serving. As I mentioned, we're working hard to make our survey more representative of the country. Our first 3 years, we have not had provincially statistically significant data for every province and territory, but we will next year. We'll have the territories in one bucket and every province separately. Even Newfoundland and Labrador, it was tough for us to find a survey provider that would do all of this, but it was very important to us as well. And we have also set a lot of quotas in the survey panel to really ensure that the NIA's Aging in Canada survey reflects the diversity of the older adult population in Canada. So we'll keep getting better at it. And we'll also keep getting better at the way we share the data with you. I always encourage folks to sign up for the NIA's newsletter. We try to publish some sort of policy product every month, but there's also incredible research that comes out of Dr. Samir Sinha, who I'm sure everyone is familiar with, quite famous geriatrician and advocate for older adults in Canada, as well as Bonnie Jean McDonald, who is one of the foremost actuaries. Apparently there are famous actuaries and I work with one. So I do encourage everybody to kind of stay on top of our NIA research because it's often quite interesting. And my personal goal in my role here as Director of Policy is to make this data as accessible as possible to our stakeholder community, because the goal here is that this data can build sector capacity across the board.
That's great. Thanks, Gabrielle. Appreciate that. So quick plug, please continue to add your questions to the Q&A function. We're going to do that right after Kahir provides a bit of an update on the year ahead.
Thanks, Karen. So, for the group, we've heard a little bit around the work that has taken place from June 2024 to June 2025. We had a bit of a conversation around the strengths, the barriers, the potential outcomes of a unified sector. Embedded in that was this idea of being community informed and really being intentional in the work that we do. So over the next year or so, we just wanted to provide a bit of a snapshot of what to anticipate as we are all on this journey together. While we're at different places on that journey, we were moving together as a pan-Canadian network, if you will. Over the next couple of months, we will be releasing the reports from some recent consultations that we have had. So up to now, we've had 6 consultations across the country: British Columbia, Yukon, Manitoba, Saskatchewan, Nova Scotia, Eastern Ontario. And we will be releasing some of the reports and findings from those consultations. And we will be looking at trending some of those findings to date. In the early fall, we will continue with consultations in Newfoundland and Ontario, where we'll be bringing organizations like yourselves together to have dialogue and conversation around some of the opportunities and co-creating a path forward for the sector within your particular jurisdiction, and helping to create a space for all of you to inform this pan-Canadian strategy and response. The fall will continue to see community conversations in Quebec and the Northwest Territories. We will be having multiple community conversations in Quebec and Ontario. And during the fall, we'll also be looking at filling some of the representational gaps that we have on the Pan-Canadian Leadership Council. And I just want to take one moment to recognize the leadership of those that sit on the Pan-Canadian Leadership Council. I know there are people on the call that also work in or serve on provincial leadership councils. This is above and beyond people's day to day. And I just want to recognize their generosity of heart, their generosity of spirit, their generosity of thought and leadership to help move this work forward. Over the winter months, we are working in partnership with the NIA to have an event to engage government partners in a really direct and formal way to advance this work. We'll be leaning on some of the community consultations to inform our key messages, but we will be leveraging HelpAge Canada's 50th anniversary as a platform event to be able to engage with government in Ottawa in over the winter. I know it's funny to say that we're planning an event in Ottawa on the winter, but this is the way the calendar works sometimes. In the early spring, we will provide or release a report on all of the consultations. So the plan is by January we would have had community conversations and consultations across the country, augmented by some virtual consultations. So for those that are not able to attend in person, and we'll be releasing a report that looks at some of the key findings, key recommendations, and really will be the Leadership Council's and HelpAge Canada's call to action in terms of how to respond to what we're hearing from organizations and territories and provinces. Then in the summer of 2026, we will reconvene as a Pan-Canadian group for our second Pan-Canadian Summit on Aging. During that time, there will be a paper released on the role of the CBSS sector in Canada, with formal policy recommendations for governments, all three levels of government, to consider in their work. Over the next year, we will really be looking at developing Pan-Canadian systems to help us co-create the path forward. And so when we think about co-creating the path forward for the sector, we're going to respond to the ideas and the suggestions that have emerged, and translate that into action, and translate that in a way that our systems partner can see themselves as part of the sector. For example, seeing how local governments see themselves as part of the sector, seeing how our health partners are part of our sector through partnerships and relationships. We'll be intentional on centering the voices of older people in the work that we do, primarily through amplifying the work that the sector does on a daily basis. We will continue to strengthen connections through consultations, but also through virtual platforms like Core Canada or the provincial core subsites like Core BC and Core Alberta, and hoping to scale those across the country. But also looking at Pan-Canadian convening tables, where people with certain levels of passion, interest, expertise can offer their knowledge in a Pan-Canadian context. We'll be highlighting and championing the shared priorities. Karen spoke about some of the shared priorities earlier around advocacy, policy reform, system redesign, sustained funding, capacity building. Some of those shared priorities will be addressed, including thematic issues, things like ageism, things like abuse and neglect, things like heightened experiences of loneliness, especially for older people with co-vulnerabilities, things like digital infrastructure for the sector, things like transportation, which is a huge challenge we know that is being expressed across the country. And then part of this work also in partnership is to really equip the sector to enhance and bolster the incredible work that's already happening, whether that's through data, whether that's through convening, whether that's communications or policy. It's really looking to evolve, specifically at HelpAge, our identity as perhaps a toolbox, if you will. So if you think about different tools in a toolbox, HelpAge has recently undergone a new strategic direction to respond to what communities and organizations across the country are telling us, as well as leveraging some of the successful models that are in existence in certain provinces and territories. So if you think about HelpAge Canada as a bit of a toolbox, there are certain tools that organizations, regardless of where in the country you may be positioned, will be able to leverage and use, hopefully in a way that will enhance your impact. So things like a shared language for communicating our purpose and value, key messages that organizations can use in conversations with their local governments, with their provincial governments, with system partners around what work we are doing as a pan-Canadian sector and the value of the sector. We'll be convening tables around advocacy and policy, funding, research, communications, government relations, but also a couple thematic areas, particularly rural and remote strategies, as well as around supporting equity denied older people. And when I say equity denied older people, some of the things that we're hearing are acute intentionality in supporting Indigenous elders, older newcomers, older people that have experienced trauma or abuse, older people that might identify as LGBTQSI, older people that might be blind or deaf or hard of hearing, those that really might require some customized programs and services and supports. Another tool in the toolbox will be looking at policy reform. We will be actively working to look at how to shift the narrative on what our sector does and who our sector is in terms of the work that we're doing. Data and evaluation can be a tricky concept. I, for one, as a person, don't want to be evaluated, but really looking at learnings and what's working, and really looking at telling a story around the impact that we're making in the lives of older people. We also know training, development, and capacity building is a real need. The proportion of CBSS organizations that have less than 3 to 4 FTE, and are operating on a real skeleton budget, don't always have an opportunity to engage in capacity building and training and development. And so those are some of the tools that will come out of HelpAge's toolbox. Looking at communication tactics, templates, graphics, and narrative to support and really amplify the impact in the stories across the country. We know every day organizations are impacting the lives of older people, and there are transformational stories that can be told to provide light onto the incredible work your staff and volunteers are engaging in. And then looking at digital infrastructure, I mean, we live in a digital world. We see the role of AI evolving, of technology evolving. And truth be told, I don't know if our sector is set up in a way to respond. And so while the digital divide is a real thing for individual people at a micro level, the digital divide is also a thing within the CBSS sector and in fact the nonprofit sector as a whole. So looking at ways to strengthen digital infrastructure. So, our vision is that the CBSS sector will be able to bolster its capacity, bolster its impact, be recognized as an influential part of serving older people, and be recognized and resourced that way. So, just some of the things to kind of look forward to over the next little while here. Karen, I'll toss it back over to you.
Yeah, thanks, Kahir. That's great. Lots of different ways for folks to get involved, and hopefully some excitement being generated by those many, many important pieces of work that are coming ahead. Um, so we're going to turn it over now to the Q&A section of our program today. I hope people will get involved, that you'll put some questions in the chat. We have the HelpAge team helping to moderate that for us. So I'm going to kick it off with a question I think would be a great fit for Marta and Bev, based on my understanding of some of the work that you guys are doing in your regions. There was a question someone put in the chat. It said, I appreciate your comments on rural and remote aging. In your experience, what are the most effective ways or venues to advocate for equity for those who choose to age in remote locations? And I'm just thinking about some of the work that you're both doing with folks that are aging in remote areas of your territories and provinces. I know that, Marta, you've shared some of the work you guys are doing around elder abuse to reach out to those communities in Ontario. And Bev, you shared already today some work around how we draw those folks into the work of the sector development work. But do you have any thoughts on that question?
Bev, did you want to go first, or I'll jump in?
You've started, you go ahead.
In Ontario, for example, one of the really great resources across communities, whether remote or rural or urban based, are the senior active living centers. This could be anything from a local library that has a lunch program or a speaker's corner, to some of the more robust exercise programs, golf, practicing your swing, so forth. So anything that essentially removes that element of social isolation, where people can gather, people can commune about certain things, and where you establish that level of trust within community, people are more likely to come forward and then share what their experiences are, what their challenges are, and that unto itself helps build community. I think one of the things we've seen an uptick in is really that involvement of intergenerational groups as well. We say by community for community, but it is not just about older adult voices, though they must be included in everything that is being developed and contemplated, but involving younger generations as well, where they have assets like, they're more tech savvy. They're able to assist with things like how to use those elusive devices that some of us are still Luddites with. Finding ways to engage in such a way that there are meaningful relationships being developed. And then each demographic group is able to complement the other in a way that they see best fits.
Thanks, Marta.
Good points there, Marta. One of the things that I notice here, because again, we're very small, when it comes to advocacy, the older adults are also the ones that are in locations where our various elected officials also congregate. So we sometimes have the ability to just kind of tap people on the shoulder and say, we'd like to work on this, or we think we need some more assistance here. And I'm not saying that it always gets results, but as far as wanting to advocate, if you're at the local play together, or if the grandparents are at a function for their school kids where the MLAs are there with their kids, there's an easy back and forth. So our elected people are they're very accessible. And so it's different, but it's just one way to help advocate.
Yeah, Bev, thanks for that. I know I'm facilitating, I'm not supposed to jump in, but I'll maybe just share that the sector development work that's occurred in Alberta with Healthy Aging Alberta, there's been a real focus around investment in rural Alberta and the community-based senior services sector as our sector development work has emerged. So, really trying to emphasize that investment in rural areas in terms of building out those non-medical supports and a real intentionality around that. So, as your sector development work emerges in your region, it provides an increased opportunity to identify where those needs are as you do sort of system mapping and identifying needs in your province or territory. And so in Alberta, it allowed us to really be able to emphasize those needs in rural Alberta and to target those investments as needed. So that's what one of the benefits was of sector development and increased coordination was to better target those investments. So just share that quick reflection. Not a panelist, but couldn't help myself. Next question is related to how could we maybe work more collectively together to educate government on what is needed in a community-based senior services sector beyond social and recreational activities, and to get policymakers to understand that seniors are served across all government departments, not just Ministry for Seniors. Well, that's a perennial challenge. I wonder if maybe Kahir or Gabrielle, if you might want to tackle that one.
I always think of that silly idiom, how do you eat an elephant? One bite at a time. And I think that that's how we have to approach educating government on the strength and value of the CBSS sector. Aging issues cut across every single silo. A seniors secretariat or minister for seniors is one voice around a cabinet table that can advocate for things, but it is our responsibility as a mature and evolving sector to make those arguments in the appropriate places across government. This is something that I'm working to do alongside Kahir. And as the sector starts to and continues to mature, we will be able to push these conversations along. The unfortunate thing is things do take time to build. That's just an unfortunate matter of fact. I saw somebody else in the chat mention about how like transportation, like, from an advocacy perspective, could we hive off these different objectives? Like transportation is a key theme for the folks that have been at many of these consultations. Transportation issues is a key theme that has come across every single consultation we've heard. And a person in the chat said, like, could we just be focused on advocating for transportation? Absolutely. There are like ways to be tactical and focus on particular individual issues. And I think that as we evolve, as we go through this process, and we get to the Pan Canadian event at the end of the yellow brick road that's on that progress slide, we'll be able to more clearly understand ourselves what we want to ask for. Because that's something that I keep saying when I'm in these meetings. I'm like, what's the ask? What do we want? What's the ask? And one of the things that we want certainly is sustained funding for the CBSS sector, but the question is, how do we get there? And that's why I think like one of those first steps is an acknowledgement of the value of the CBSS sector. And to get there, these are all such incremental things, but to get there, we need to be able to measure it. And that's what we're doing right now through this process. So we're on the train, we're on the tracks. It's just going to take some time, but we will keep eating the elephant one bite at a time.
Engaging with governments is such an interesting and fascinating world. And, I'll just add a couple thoughts to what Gabrielle said. And I agree with everything Gabrielle said is the reality is governments are dynamic and governments need to respond to the evolving landscape. We need to be able to also um, understand how we are also partnering with government in their mandates and priorities. And I think the beautiful thing about our sector is that it crosses it's nonpartisan. It crosses different priorities, and we're able to tell our story and craft our story in a way that meets the priorities of the day. And sometimes those priorities are moving goalposts, and that speaks to the need for us to be able to be mature enough to nimble and pivot as required. And I think that this is a multi-entry point initiative. Ultimately, the people that we serve is our North Star. Like the end goal is supporting older people in their communities, which comprise a large part of the Canadian population. So there is also a micro political angle on the work that we do in terms of the voter base, in terms of having elected officials listen to constituents. And some of the work that we hope to do is to empower and create tools and instruments that local organizations can use to effectively engage in government relations work.
Thanks, Kahir. Marta, did you have anything you wanted to add from the perspective of the Leadership Council?
Oh, I do. I'm biting my cheek here.
You might.
So we talked about relational things with government, given what the election cycles are like. There's a very short time period in which we can inject ourselves into conversations in a meaningful way. I don't think anybody across the sector, regardless of what the specific issues that you're an expert in, that your messaging will have changed, that the ask really has inherently changed. It's important, I think, to develop relationships with those that are either in office or are part of a larger ministry, because let's face it, they all do serve seniors in some capacity. To make this a personal thing, find the humanity in what that issue is. When we lobbied at Queen's Park Day, we had an education day a couple of years ago, and we were surprised to hear how many people didn't even know that elder abuse was the thing. They may have heard about it in a paper, but not until it hits home, not until it's personal, that it's happened that, a family member has been financially exploited or someone has been physically harmed, does the light bulb actually go off. So we need to find human ways to tell those stories. And they're not necessarily all packaged on a neat little infographic that we just leave behind when we go to senior wellness fairs. These are conversations we need to have with people that are in positions of authority so that they understand the impact of not investing properly in the sector.
Can I add also, I'm reading in the chat and it's moving so quickly. Patty, I lost her, but I think Patty Petrala had made a comment in the chat about it's summertime and your members of parliament are at home in their constituencies. Book a coffee with them. She's absolutely right. Kahir and I put out, or a bunch of organizations put out a letter during the election about the voting impact of older adults. I had a piece in the Toronto Star with pollster David Coletto about how older adults are the most reliable population of voters. Older adults go to the polls. This is a population that votes. Politicians should be listening to this incredibly strong voting demographic that shows up at the ballot box reliably every time. And that's like your local member of parliament wants to meet with you. They actually do. Like an older adult organization is just easy. That's happy. That's good. Everyone likes old people. Like your local member of parliament does actually want to meet with you. That's such great advice from Patty in the chat, is that, send your local member of parliament an email today. It might take them 6 weeks or 8 weeks to get back to you. I'm still booking some meetings on one of Bonnie Jean's pieces of research that I sent stuff out on in January. But make that outreach and start to form that relationship, because older adults have not been the best at getting loud about what's important to them, whereas so many other sectors are. I think it might have been Karen that made this point while we were in Nova Scotia last week. And it's that the senior serving sector is one of the only sectors that hasn't been deputized by government to provide services to their own sector. So Karen, this was your point, right? This conversation, it was, okay, yes. That Karen and I had an awesome conversation about this. She pointed out that, for instance, like if you look at like the gender or like sex trafficking or childcare, all of these sectors have been tapped by government to provide services to their own sector. But that hasn't happened in a formal way in the CBSS sector. Karen pointed out that there's some like internalized ageism there, and I think she's absolutely right. But I think part of it is like you don't know what you don't know. And as Kahir said, there's always like a multitude of government priorities. Kahir made a really important point, I thought, about aligning our priorities with that of government. So it's like win-win-win. How can we bring them solutions to their problems? But it starts with relationships and it starts with knowing you. And honestly, they do want to meet with you. So send an email today, like while we're talking for the next 15 minutes, just Google your member of parliament, send an email and say like, I'd love to introduce you to my organization. and tell you what we care about. And you don't have to have a sophisticated ask. People get freaked out about dealing with government or talking to politicians. You don't have to have a sophisticated ask. You don't have to have a slide deck or anything like that. Your ask can just be, "Hi, I'd like to meet you and tell you about what my organization cares about."
Yeah, it's a great discussion. Thanks for putting comments in the chat, everyone, as we're moving through this. The topic of transportation has come up in a couple different ways, so I'm going to pose sort of a two-part question for the group to consider. Um, I'm just wondering if we could really reflect on how maybe working together as a sector across all provinces and territories on a topic like transportation might be beneficial from a policy perspective. Um, and then secondly, the whole piece around how we, as we come together as a CBSS sector, the whole piece around knowledge sharing. So, how do we create communities of practice to share knowledge around how folks are addressing issues like transportation? There's some questions around how folks are addressing issues around transportation in their own communities and their own regions, around things like volunteer recruitment. So maybe just a twofold question. We'll use transportation, but I mean, you could also address that same question around things like housing or intergenerational programming, senior centers. There are many different topics, but let's focus on transportation. So, how could we maybe address an issue like transportation from an advocacy perspective across provinces and territories? And then similarly, how do we create communities of practice for sharing of best and emerging practices around these types of topic areas? Does anybody want to kick us off on that question?
Maybe I'll start off and then I'll let those wiser than I contribute more. But one of I'll offer maybe two or three points. Number one is transportation is something that I think affects every single territory and province that we've had the honor of visiting. And whether it's transportation to medical appointments or whether it's transportation to social outings to keep people connected, we know that transportation correlates with a better quality of life. If you have it, you're more likely to access programs and services and be socially connected. We also know that we're not the only ones that need to be at the table in resolving this issue. We need our systems partners at the table. And so, part of the work that we can do is elevate and amplify the issue and how it's actually impacting the lack of transportation impacts systems and processes, and that we do need an effective approach to this. I will also say it's not just older people that are impacted by lack of transportation options, and transportation options are more acute, I would suggest, in some of the rural, remote communities. So we need a bit of a holistic perspective on this. In terms of understanding how organizations might be supporting this, I'll offer a couple of thoughts. One is volunteers are a lifeline to the work that we do. But sometimes there may be a risk of downloading work to volunteers. And I think it's important that we find the balance around the right participation of volunteers. But we also know that there are many volunteer transportation programs. There are some unique models that are happening across the country. And this is where a coordinated sector can come together to be able to learn and scale what's working in certain provinces and territories. So whether that's a transportation discussion group on the Core Canada platform, whether it becomes a item or a priority discussion in community consultations, I think when we connect and learn from each other, we can better understand what's happening in the field of transportation. The third thing I would say is transportation is a key element of the age-friendly movement. There is there are different domains on the age-friendly movement, and it is something that the government of Canada actually supported the development of globally, in fact. And so doing some advocacy around the age-friendly environment and movement to be able to work with system partners, including local governments, to advance the transportation issue could be an entry point into this work. But I'll let others more wiser than I add further thoughts.
Thanks, Kahir. Would somebody like to build on that? Thoughts about transportation, Marta?
I would just like to add that whatever happens at the local level is unto itself a business case. So when you approach other levels of government, you can already demonstrate what works, what capacity there is in a limited form, how this then becomes scalable at a larger environmental perspective across Canada. But this is something that municipalities typically look after. If you're in a rural environment, that unto itself becomes a challenge. But I know that there are a lot of good programs out in Ontario, for example, where senior active living centers or retirement homes will offer their shuttle buses for various activities for older adults in more remote locations. So again, it's an opportunity to build on something that's already working, just needs to be resourced properly to be more consistent and sustainable.
Yeah, great point, Marta. And I think that whole piece around a community of practice where we can share those models that are working. I think an observation from the assisted transportation program that's been funded in Alberta through the community-based senior services sector, it's a start. There's some great work that's happening, but the sustainability piece is really key. A lot of the models rely on volunteers. People get burnt out. That whole pipeline of volunteers is really key. And the community of practice. We have a community of practice on core where people can share what's working and what's not. Um, and people are so creative. It really does reflect why the community-based senior services sector is a unique and essential sector that works in parallel with the health system and the housing system. Because it's uniquely agile, it's uniquely aware of the unique challenges and assets within each community. And so each transportation model is different in each community. And so I think that asset-based community development approach is really reflected in those transportation programs. And so having a community of practice where you can share that creativity has been really critical. So a shout out for CORE. If you're not already on CORE Canada, definitely do sign up. It's a great opportunity to learn more about what's happening in the sector. I think we might have time for one or two more questions, maybe one last question, and then we'll do some closing remarks. Maybe I'll open this up to everybody. How do we connect with older adults who maybe aren't the type that are going to actively engage with events in their communities? I think we might all know those people in our communities or in our personal lives. I can definitely say myself, I'm so involved in this work professionally, but trying to get my own parents to show up at events in their community is a whole nother thing. What are some of the things that we've learned professionally or in our networks around reaching out to folks who might be experiencing social isolation or who aren't well connected to networks within the CBSS sector? Any thoughts on that, and how do we maybe learn from our colleagues in this space? It's such a critical piece.
I think if COVID has taught us anything, that even wearing a mask, but peering your head over the fence to your neighbor to just check in and see if they're okay. Is there anything that's going on that they would like to share with you? Again, it's establishing that relationship of trust where people are more likely to disclose what their needs are, what their concerns are. And by the same token, as professionals, we're able to offer opportunities for them. That there's something happening at the local library. Did you know? So we become that conduit almost on a one-to-one basis. But that individual tells someone else, they tell someone else, and that's how the network unto itself grows as well. We are those community builders, and we have opportunities with, I walk down the street and, used to be frowned upon, but I start talking to older people just to make sure that they're okay. It's a really hot day outside. Have a seat here on the bench. I'll go get you a glass of water. We need to be kind to each other, and I think it's one person at a time.
Yeah, thanks for that, Marta. That's a good reminder. Bev, did you have some thoughts you might like to share?
I do. I perhaps part of it is that everybody comes from a different place in their background, and so like Karen, you mentioned about you're getting your parents out to events. Well, maybe they're not interested in events, but maybe there's other things that they do where they connect with people that maybe you're not aware of. And so sometimes maybe we try to pigeonhole people to the wrong thing, and trying to find out what would interest them that would make them happy to connect. I had a senior friend a number of years ago, and took her for a little drive. And I said, well, would you like to go a little bit further? And she said, I haven't gone there since I didn't have my car. So we made a nice little loop, and that just was a perfect. So it's looking maybe not at the big events, but more smaller groups too.
Yeah, that's great advice. Thanks, Bev. Kahir, Gabrielle?
Can I tell you what? In a few years ago, I used to run a CBSS organization in Vancouver's inner city. And it was, at that community, hyper local level, that we got to know the older people as our neighbors. And, really knowing like what are the barriers? Are you caring for someone and that care because of caregiving, you're not able to attend? Do you not feel comfortable because you speak a different language? Do you maybe have an intersectional identity that doesn't make you feel safe in a particular space? I think the incredible value of this sector is that you can leverage those relationships with your neighbors and that you're serving, and really understanding at the micro level, at the human level, what are some of those barriers. And then there are some people that we just don't know about. I remember there was a particular program during the pandemic where a postcard was distributed to some of the the poorest postal codes in that province, to saying, "Hey, are you an older person? If do you need help? Reach out." And hundreds of older people were quote unquote found through that process. So just being creative in how we're reaching out to be able to engage people at that human personal level.
Thanks, Kahir. Any closing thoughts, Gabrielle? Oh, Gabrielle might be frozen. That's okay. There are some really great thoughts in the chat as well around intergenerational connections and peer-to-peer connections in the neighborhoods, which I think are excellent comments. Gabrielle, you just froze for a second there. So we were just saying there's some great comments in the chat as well around approaches. Yeah, I think your sound is not working as well.
Yeah.
So have
Can you hear
any?
me now?
Yeah.
Okay, sorry about that, guys. There's less for the NIA to add to a question like that because we are not sort of sector facing. But what I will say is that the loneliness numbers in the NIA survey have not gone up or sorry, rather not gone down. People are not less lonely in the wake of the pandemic. We started our survey during the pandemic, and it would have made sense for the numbers around loneliness and social isolation to decrease once the world opened up again, but they haven't. And that shows us that there's a lot of these ways of interacting that were set in a frame post-COVID, and there's a lot of work to be done to like peel those layers back.
Yeah. Thanks so much, Gabrielle. Okay, I'm going to close this off so that we finish on time. I want to thank our panelists for being here. We really appreciate your time. And thank you everyone who came and made the time. We know how busy folks are in the sector, so we really appreciate you being here. A recording of today's event will be available on HelpAge's website. I know there was lots of questions about when the next regional gatherings are occurring. Also watch HelpAge's website for that. There's always great information on Core Canada, so please do sign up for that as well. Thank you again for being here and making the time. And we look forward to engaging in sector development work with all of you. So thank you for connecting today.